Question 67. A technician uses an electronic leak tester to scan the long shaft of a laparoscopic grasper. The technician focuses intensely on verifying the completely intact plastic coating covering the metal shaft. What is the primary clinical purpose of this specific protective material during an active surgery? A. To completely shield the operating surgeon from accidental thermal burns outside the body. B. To provide a textured physical grip preventing the instrument from slipping, providing stability. C. To protect the patient internal organs from unintended electrical current arcing. D. To completely prevent the targeted patient tissue from undergoing physical cauterization. Correct answer C. Knowledge point explanation. Core rationale. Laparoscopic instruments frequently transmit high-voltage electrical current down their metal shafts to cauterize tissue at the distal tip. The plastic insulation coating acts as an absolute barrier, preventing this dangerous electrical current from escaping the shaft and burning adjacent healthy organs inside the patient abdominal cavity. Trap analysis. Option A. The surgeon is protected by the non-conductive proximal handle located entirely outside the patient body, not the shaft insulation. This option would be correct if the question asked what purpose the heavy plastic casing on the main electrosurgical generator unit serves. Option B. The insulation is typically smooth to slide through a trocar and is not engineered for physical gripping. This option would be correct if the question asked why the proximal handle features ergonomic molded finger grooves. Option D. Cauterizing the targeted tissue at the exposed metal tip is the exact intended medical function of the instrument. This option would be correct if the question asked what clinical effect is completely neutralized when an electrosurgical grounding pad is improperly attached to the patient. Concept extension. A microscopic pinhole in this insulation that is invisible to the naked eye can concentrate the electrical current, causing severe internal patient burns, which is why routine electronic insulation testing is mandatory. Question 68. A clean assembly technician physically inspects the environmental wall gauge outside the preparation and packaging area where coworkers are wrapping sterile orthopedic trays. To strictly comply with AAMI guidelines, what specific air pressure dynamic must the technician visually verify for this critical room? A. A strict negative pressure flow actively pulling air inward. B. A strict positive pressure flow actively pushing air outward into adjacent spaces. C. Exactly 4 total air exchanges per hour regardless of the physical pressure reading. D. An ambient airflow pulled directly from the decontamination room for maximum efficiency. Correct answer B. Knowledge point explanation. Core rationale. The preparation and packaging room is a clean area where highly vulnerable disinfected instruments are assembled before sterilization. To protect these items from airborne contamination, the room must maintain positive air pressure. This means the ventilation system actively pushes clean filtered air outward into surrounding hallways, physically preventing dust and microbes from entering when the doors open. Trap analysis. Option A. Negative pressure pulls air inward, which would suck dirt and pathogens from the hallway directly onto the clean instruments. This option would be correct if the technician were verifying the ventilation for the heavily contaminated decontamination sink area. Option C. 4 air exchanges per hour is the standard exclusively for the sterile storage area, while the prep and pack area strictly requires 10. This option would be correct if the technician were inspecting the airflow in the room where fully cooled sterile packages are placed on wire shelves. Option D. Pulling air from the decontamination room would flood the clean assembly area with massive amounts of biohazardous aerosols. This option would be correct if the question asked what catastrophic facility failure guarantees an immediate shutdown of the entire sterile processing department. Concept extension. Technicians can perform a simple tissue test by holding a piece of paper near a slightly cracked door to visually verify that the positive airflow is actively blowing the paper out into the hallway. Question 69. A technician carefully removes a biological indicator vial from a specialized incubator after processing a heavily soiled loaner tray through a terminal steam cycle. The negative reading confirms that every single living microbe inside the chamber, including highly resilient bacterial spores, has been definitively eradicated. What exact scientific terminology describes this total microbial destruction? A. An extended high-level chemical disinfection soaking process. B. An automated thermal disinfection cycle utilizing highly heated water. C. A validated terminal sterilization process utilizing pressurized steam. D. A prolonged intermediate-level chemical disinfection surface wipe process. Correct answer C. Knowledge point explanation. Core rationale. Sterilization is the absolute highest level of microbial lethality in healthcare. It is specifically defined as the complete destruction of all forms of microbial life. Only a validated sterilization process such as pressurized steam or ethylene oxide gas possesses the necessary energy to completely penetrate and eradicate dormant bacterial spores, which are the most resistant life forms on Earth. Trap analysis. Option A. High-level disinfection eradicates vegetative bacteria but cannot reliably kill large populations of highly resistant bacterial spores. This option would be correct if the technician were processing a flexible gastroscope intended to only contact intact mucous membranes. Option B. Thermal disinfection utilizes hot water to kill pathogens, but the temperatures reached in a washer do not achieve true spore lethality. This option would be correct if the technician were verifying the final rinse phase of a mechanical washer disinfector cycle. Option D. Intermediate disinfection kills mycobacteria but specifically fails to destroy dormant bacterial spores. This option would be correct if the technician were wiping down a stainless steel worktable between instrument assembly tasks. Concept extension. A negative biological indicator means the spores inside the test vial did not grow, proving the sterilization cycle was successful and the instruments are safe for surgical use. Question 70. A technician fills a manual scrubbing sink with warm utility water and prepares to measure out a standard cleaning solution for a large batch of delicate stainless steel microsurgical instruments. To protect their own skin integrity and prevent chemical corrosion on the fragile devices, which specific chemical balance must the technician select for the detergent? A. A highly acidic low pH formulation designed for rapid descaling. B. A highly alkaline high pH concentrate engineered for dissolving heavy fats. C. A completely neutral pH solution optimized for manual human contact. D. A variable pH liquid that changes properties depending strictly on the water temperature. Correct answer C. Knowledge point explanation. Core rationale. Neutral pH detergents, generally measuring between 7 and 8 on the pH scale, are the absolute standard for manual cleaning in the sink. They are chemically gentle enough to protect the technician's skin during manual scrubbing while simultaneously preventing pitting and corrosion on delicate medical instruments, especially those constructed from aluminum or anodized titanium. Trap analysis. Option A. Acidic low pH detergents severely damage instrument passivation layers and are highly irritating to human skin. This option would be correct if the technician were utilizing a specialized chemical to remove hard water scale buildup from the interior walls of a mechanical washer chamber. Option B. High pH alkaline detergents are highly corrosive to delicate items and human skin and are strictly reserved for closed automated systems. This option would be correct if the technician were loading heavy stainless steel orthopedic retractors into a mechanical washer disinfector. Option D. The pH level is a fixed chemical property of the detergent formulation and does not dynamically change based on the water temperature. This option would be correct if the question asked what specific operational factor dictates the speed at which enzymatic detergents actively break down blood proteins. Concept extension. While neutral detergents are incredibly safe, they are less effective at removing heavy grease, requiring technicians to rely more heavily on direct mechanical friction with brushes to achieve a clean surface. Question 71. After removing a batch of dried hemostats from the mechanical washer, a technician must verify that the box locks are completely free of bioburden and that the ratchets hold securely. In which specific departmental zone must the technician physically perform these critical verification tasks? A. The negative pressure decontamination sink area. B. The terminal sterilization autoclave loading zone. C. The dedicated climate-controlled sterile storage room. D. The positive pressure clean preparation and packaging area. Correct answer D. Knowledge point explanation. Core rationale. The preparation and packaging area is the designated clean zone where technicians inspect all instruments for definitive cleanliness and proper mechanical functionality before assembling them into trays for sterilization. Any item found with residual soil here must be immediately sent back to the decontamination area. Trap analysis. Option A. The decontamination area is for active cleaning, not final cleanliness inspection. This option would be correct if the question asked where a technician performs the initial manual scrubbing to remove gross soil. Option B. The loading zone is too late in the process because the trays are already completely sealed inside protective wrappers. This option would be correct if the question asked where a technician verifies that the external chemical indicator tape has been applied to the package. Option C. The sterile storage room holds finished inventory ready for patient use. This option would be correct if the question asked where a technician checks the integrity of a dust cover on a fully cooled surgical tray. Concept extension. Technicians utilizing lighted magnifying lamps in this area can easily spot microscopic bone fragments hidden deep inside rongeur jaws, preventing surgical site infections. Question 72. A technician is gathering delicate micro-instruments for an otorhinolaryngology procedure designed to extract a thickened auditory bone that no longer vibrates and replace it with a synthetic prosthetic. Based on this anatomical description, what exact surgical procedure is the technician preparing for? A. A microscopic tympanoplasty procedure. B. A delicate physical stapedectomy procedure. C. A routine bilateral myringotomy procedure. D. An extensive mastectomy procedure. Correct answer B. Knowledge point explanation. Core rationale. A stapedectomy utilizes the root word staped referring to the stapes bone in the middle ear and the suffix ectomy meaning surgical removal. This procedure specifically removes the diseased thickened stapes bone responsible for otosclerosis and replaces it with an artificial implant to restore mechanical sound wave transmission. Trap analysis. Option A. A tympanoplasty repairs a perforated eardrum using the suffix plasty for reconstruction rather than removing a bone. This option would be correct if the technician were pulling instruments to patch a hole in the tympanic membrane. Option C. A myringotomy creates an incision in the eardrum to drain fluid using the suffix otomy for cutting into. This option would be correct if the technician were gathering tiny ventilation tubes for a pediatric ear fluid drainage case. Option D. A mastectomy removes infected bone cells from the mastoid process behind the ear, not the vibrating stapes bone. This option would be correct if the technician were processing heavy surgical drills used to clear chronic temporal bone infections. Concept extension. Trays utilized for middle ear procedures contain exceptionally tiny alligator forceps and micro picks that easily puncture peel pouches, requiring careful placement of silicone tip protectors. Question 73. A decontamination technician is vigorously brushing a bloody orthopedic reamer when they suddenly sustain a sharp puncture wound through their heavy gloves. To rapidly assess their occupational risk for the most widespread chronic bloodborne infection requiring standard precautions, which specific pathogen must the technician immediately report exposure to? A. The infectious hepatitis A virus. B. The vaccine-preventable hepatitis B virus. C. The highly prevalent hepatitis C virus. D. The acquired human immunodeficiency virus. Correct answer C. Knowledge point explanation. Core rationale. According to federal health data, hepatitis C represents the most common chronic bloodborne infection in the modern healthcare landscape. Because there is currently no preventative vaccine available for this specific virus, technicians must rely entirely on rigorous personal protective equipment and safe, sharp handling techniques to prevent occupational transmission. Trap analysis. Option A. Hepatitis A is transmitted via the fecal-oral route, commonly through contaminated food or water, not through bloodborne sharps exposures. This option would be correct if the question asked what specific viral infection a technician contracts through improper cafeteria food sanitation. Option B. Hepatitis B is a dangerous bloodborne pathogen, but its chronic prevalence has drastically decreased due to mandatory employer-provided vaccination programs. This option would be correct if the question asked what specific viral prophylaxis the facility occupational health nurse must immediately offer the punctured technician. Option D. Human immunodeficiency virus is a severe bloodborne pathogen, but it is significantly less prevalent as a chronic occupational infection compared to hepatitis C. This option would be correct if the question asked what specific pathogen entering the puncture wound actively destroys the human immune system T cells. Concept extension. If a technician sustains a puncture wound while scrubbing a bloody orthopedic reamer, they must immediately wash the site with soap and water and report to occupational health for rapid hepatitis C screening. Question 74. While pulling sterile inventory for an emergency abdominal surgery, a technician reads a preference card requesting heavy tissue clamps for a massive gastrointestinal resection. To ensure the correct instruments are successfully provided, the technician must understand that the medical root word gastro physically refers to which specific internal organ? A. The extensive large colon tissue. B. The actively pumping cardiac muscle. C. The primary digestive stomach organ. D. The dense internal hepatic structure. Correct answer C. Knowledge point explanation. Core rationale. In standard medical terminology, the root word gastro directly identifies the stomach. When combined with other terms such as intestinal, it describes procedures or conditions relating to the entire digestive pathway starting from the primary stomach organ. Trap analysis. Option A. The colon utilizes the medical root colo or colon. This option would be correct if the technician were gathering long linear staplers for a colectomy procedure. Option B. The heart utilizes the medical root cardio. This option would be correct if the technician were inspecting a heavy sternal retractor for a cardiovascular bypass procedure. Option D. The liver utilizes the medical root hepato. This option would be correct if the technician were assembling specialized dissecting instruments for a hepatic lobectomy. Concept extension. Trays requested for gastro procedures often contain very heavy and long instruments, requiring technicians to strategically place them on the absolute bottom of the sterilization container to prevent crushing lighter items. Question 75. Inside the operating suite, a surgical technologist utilizes a sterile water sponge to wipe heavy blood and tissue clumps off a stainless steel retractor immediately after the surgeon finishes using it. What is the fundamental clinical purpose of executing this specific physical treatment directly at the point of use? A. It serves to completely replace the manual scrubbing phase legally required in the decontamination area. B. It initiates the overarching cleaning process by preventing thick organic gross soil from drying onto the metal. C. It actively increases the required turnaround time between scheduled surgical patients delayed by cleaning delays. D. It achieves high-level chemical disinfection, allowing the instrument to be utilized safely on the next patient immediately. Correct answer B. Knowledge point explanation. Core rationale. Point-of-use treatment is the absolute first phase of instrument reprocessing. Wiping away heavy soil immediately in the operating room prevents blood proteins and fats from hardening into a cement-like crust on the metal. This crucial proactive step prevents severe pitting corrosion and makes the subsequent decontamination process much more successful. Trap analysis. Option A. Point-of-use treatment never replaces full decontamination procedures. This option would be correct if the question described a completely fabricated shortcut that grossly violates all established AAMI safety guidelines. Option C. Proper point-of-use treatment actually significantly decreases processing time by making the items easier to clean later. This option would be correct if the question asked what negative consequence occurs when instruments are sent to decontamination covered in rock-hard dried blood. Option D. Sterile water wiping provides zero disinfection capabilities. This option would be correct if the question asked what specific chemical bath process kills mycobacteria on a flexible endoscope, ensuring it is safe for mucosal contact. Concept extension. Saline must never be utilized for point-of-use wiping because the heavy salt chloride content actively eats through the stainless steel passivation layer, causing irreversible pitting damage. Question 76. A decontamination technician receives a highly contaminated rigid container from an isolation patient room. To definitively break the chain of infection at its absolute source, what physical action must the technician prioritize regarding the causative microbe itself? A. Eliminate the pathogen, completely destroying its ability to infect. B. Don appropriate personal protective equipment before touching the item. C. Process the item through a standard high-temperature steam sterilizer. D. Report the initial exposure incident immediately to the facility OSHA representative. Correct answer A. Knowledge point explanation. Core rationale. The chain of infection requires a causative agent or pathogen to initiate the spread of disease. While there are many ways to block transmission, the only absolute way to interrupt the chain at its fundamental source is to physically eliminate the causative agent entirely, making it impossible for the disease to spread to a susceptible host. Trap analysis. Option B. Wearing personal protective equipment strictly blocks the portal of entry for the worker, but it does not eliminate the microbe from the environment. This option would be correct if the question asked what specific physical barrier method the technician utilizes before opening the contaminated container. Option C. Processing an item through a sterilizer is one specific method used to achieve elimination, but elimination itself is the overarching principle. This option would be correct if the question asked what specific machine cycle the technician physically operates to guarantee the destruction of dormant bacterial spores. Option D. Involving OSHA is a legal reporting requirement, not a physical method of breaking the chain of infection. This option would be correct if the question asked what administrative action the technician must take if they suffer a contaminated needle stick injury while inspecting the container. Concept extension. Eliminating the causative agent can be achieved through rigorous manual cleaning followed by either high-level chemical disinfection or terminal steam sterilization, depending on the Spalding classification of the medical device. Question 77. A circulating nurse rushes into the prep area with a dropped solid metal retractor, demanding the technician process it via an immediate-use steam sterilization cycle to save the open patient. According to AAMI standards, under what specific operational circumstance is the technician permitted to run this cycle? A. Only when the facility lacks sufficient time to process the item utilizing a standard terminal wrapper. B. Whenever stainless steel metal instruments are involved, as it is the preferred primary method. C. When the surgical turnover time must be reduced by skipping the manual cleaning phase. D. Whenever the facility operating room management recommends it as the primary daily processing protocol. Correct answer A. Knowledge point explanation. Core rationale. Immediate use steam sterilization is strictly an emergency process. It is never intended for routine inventory management. The only acceptable justification for utilizing this unwrapped fast cycle is when an unforeseen emergency occurs, such as dropping a one-of-a-kind instrument and there is absolutely zero time to process the item via the traditional terminal sterilization method. Trap analysis. Option B. Terminal wrapped sterilization is always the preferred method for metal instruments because it allows the item to be safely stored and transported. This option would be correct if the question asked what specific processing method is the gold standard for heavy orthopedic sets. Option C. Skipping the manual cleaning phase is a catastrophic safety violation that guarantees sterilization failure. This option would be correct if the question asked what illegal and dangerous shortcut technicians might be tempted to take when pressured by angry surgeons. Option D. AAMI and the Joint Commission strictly forbid utilizing immediate use cycles as a primary routine protocol regardless of hospital management preferences. This option would be correct if the question asked what specific policy dictates the dress code for non-scrubbed visitors entering the surgical core. Concept extension. Instruments processed via this emergency method are extremely hot and wet when the door opens, requiring the technician to utilize sterile heat-resistant gloves during the transfer to the operating room. Question 78. A technician is retrieving a heavy terminal sterilized tray wrapped in blue synthetic material from a wire storage shelf to build a morning case cart. To prevent damaging the sterile barrier, how must the technician physically remove the item from the rack? A. Carefully lift the entire package straight up and away from the shelf surface. B. Gently pull the package forward, sliding it along the wire rack to the front edge. C. Push the package toward the back wall to allow room to grip the front handles. D. Stack multiple packages on top of the tray and lift them all simultaneously. Correct answer A. Knowledge point explanation. Core rationale. Aseptic handling techniques dictate that a wrapped sterile package must never be dragged or slid across any surface. Dragging a heavy tray across a wire shelf creates intense friction that easily tears microscopic holes in the synthetic wrapper, immediately rendering the item unsterile. The technician must firmly grip the sides and lift the tray straight up before pulling it out. Trap analysis. Option B. Pulling or sliding the package along the metal wires acts like a cheese grater and will slice through the protective barrier. This option would be correct if the question asked what specific negligent handling action guarantees a tray will fail a visual inspection at the sterile field. Option C. Pushing the package backward risks knocking items off the rear of the shelf, causing severe drop damage. This option would be correct if the question asked what careless action during stocking causes rigid containers to crash onto the floor behind the shelving units. Option D. Stacking heavy items compresses the wrappers, forcing air out and potentially damaging delicate instruments inside. This option would be correct if the question asked what specific storage violation causes heavy retractors to pierce through the bottom of a blue-wrapped pan. Concept extension. If a technician suspects a wrapper was dragged, they must physically inspect the bottom of the tray for any shiny metal showing through the blue fabric, which confirms a sterile breach. Question 79. A materials management technician is processing a massive delivery of surgical supplies in the external breakout area. After opening the large corrugated shipping boxes, which specific internal packaging unit is safely permitted to be transferred onto the pristine sterile storage room racks? A. The smaller internal shelf cartons holding the individual sterile items. B. The heavy corrugated cardboard transport boxes containing multiple supplies. C. Any non-corrugated cardboard box regardless of its external shipping history. D. Absolutely zero cardboard containers of any type are permitted in the clean storage area. Correct answer A. Knowledge point explanation. Core rationale. External shipping boxes gather massive amounts of dust, fungi, and warehouse pests during transit and are strictly prohibited from entering clean areas. However, the smaller inner shelf cartons, such as a clean box holding 50 individual suture packets, are protected during transit and are permitted to be placed directly onto the sterile storage wire shelves. Trap analysis. Option B. Heavy corrugated boxes are porous and harbor insects, making them a severe biohazard to the sterile inventory. This option would be correct if the question asked what specific item must be immediately broken down and thrown into the recycling bin within the breakout room. Option C. Permitting any box regardless of its history allows contaminated items into the sterile core. This option would be correct if the question asked to identify a blatantly false statement regarding proper materials management protocols. Option D. While corrugated cardboard is banned, clean inner shelf cartons are specifically engineered for this exact storage purpose. This option would be correct if the question described the internal sterile core of the operating room where absolutely no paper products or outer boxes are allowed. Concept extension. technicians must inspect the inner shelf cartons for any signs of crushing water stains or expiration before transferring them to the storage shelves to ensure product integrity. Question 80. A technician is struggling to manually clean a complex orthopedic reamer heavily coated in dried bone marrow at the decontamination sink. If the technician physically fails to significantly reduce this massive microbial population before passing the instrument to the clean area, what exact negative consequence will inevitably occur during the subsequent sterilization phase? A. The item will become significantly more difficult for the sterilant gas or steam to successfully process. B. The autoclave load will legally require a higher quantity of biological indicator vials to verify lethality. C. The required exposure time for the specific steam cycle will automatically decrease. D. The heavy metal instrument will require a drastically longer cooling period after the cycle completes. Correct answer A. Knowledge point explanation. Core rationale. Sterilization operates on a mathematical probability of microbial kill. The bioburden is the total number of invisible microbes on an item. If a technician fails to adequately clean an item leaving a high bioburden load, the standard sterilization cycle time simply may not be long enough to penetrate the soil and kill the massive number of spores, guaranteeing a sterilization failure. Trap analysis. Option B. The quantity of biological indicators is based on the sterilizer size and the presence of implants, not the bioburden of a single poorly cleaned item. This option would be correct if the question asked what physical loading action requires the technician to utilize a higher quantity of biological indicator vials. Option C. High bioburden mathematically requires more time to achieve lethality, never less. This option would be correct if the question asked what happens to the physical cycle parameters when the technician processes a single unwrapped instrument. Option D. Cooling time is dictated solely by the total metal mass and physical density of the instruments, not the microscopic biological load. This option would be correct if the question asked what consequence occurs when the technician loads heavy dense metal retractor sets into the chamber. Concept extension. Residual dried bone marrow physically shields bacteria from the high heat of steam, acting as an insulated fortress that completely invalidates the lethality of the autoclave cycle. Question 81. During a routine environmental inspection of the sterile storage room, a technician discovers that the facility HVAC system has malfunctioned, dropping the ambient humidity to an extremely dry 15%. What specific physical degradation of the packaging materials must the technician urgently look for due to this severely low moisture level? A. The chemical indicator tape completely losing its adhesive grip on the blue wrappers. B. The printed tracking labels peeling off the sides of the rigid aluminum containers. C. The transparent plastic films on the paper plastic pouches becoming completely brittle and cracking. D. The heat-sealed seams on the paper plastic pouches chemically loosening and separating. Correct answer C. Knowledge point explanation. Core rationale. Environmental humidity in the sterile storage area must be strictly maintained between 30 and 60%. If the air becomes excessively dry, dropping below 30%, it physically draws moisture out of the packaging materials. This causes plastic materials such as the clear side of a peel pouch to become extremely brittle and easily crack, compromising the sterile barrier. Trap analysis. Option A. Tape losing its adhesion is a direct result of excessively high humidity where moisture attacks the glue. This option would be correct if the question asked what specific failure occurs when the storage room humidity spikes to 80%. Option B. Labels peeling off hard surfaces is caused by heavy moisture degrading the adhesive backing. This option would be correct if the question asked what tracking failure is commonly observed in a hot, damp storage environment. Option D. Heat seals loosening is a failure mode directly associated with excessive moisture and high humidity softening the bonded plastic. This option would be correct if the question asked why a perfectly sealed pouch spontaneously opens on a shelf in a humid room. Concept extension. Maintaining proper climate control prevents event-related sterility failures, and if a humidity excursion occurs, all affected packages must be thoroughly inspected for integrity before being dispensed to the operating room. Question 82. A technician in the clean assembly area is verifying the functional sharpness of a long, thin orthopedic instrument featuring a small cup-like scoop at the distal tip. To perform this specific quality assurance check safely without damaging the delicate cutting edge, which exact testing material must the technician utilize? A. A thick rigid sheet of orange synthetic testing plastic. B. A standard cylindrical plastic dowel rod. C. A thick sheet of red latex testing material. D. A standard thick paper cardboard index card. Correct answer B. Knowledge point explanation. Core rationale. The instrument described is a bone curette which utilizes a sharpened scoop to scrape away small pieces of bone or tissue. Industry testing standards dictate that curettes must be tested utilizing a plastic dowel rod. The technician gently scrapes the curette against the plastic rod, and it must bite into the material cleanly without sliding to confirm appropriate surgical sharpness. Trap analysis. Option A. Orange testing material is highly rigid and utilized exclusively for testing heavy-duty shearing instruments. This option would be correct if the technician were verifying the physical cutting action of a heavy-duty liston bone cutter. Option C. Red latex is utilized to test the slicing capability of large surgical scissors. This option would be correct if the technician were inspecting a heavy 8-inch Mayo dissecting scissor. Option D. An index card is utilized to test the clean punching action of heavy bone biters. This option would be correct if the technician were testing the jaw alignment of a double-action kerosene rongeur. Concept extension. The plastic dowel rod is also utilized in the preparation area to physically verify the internal patency and structural straightness of hollow orthopedic cannulas and suction tips. Question 83. While processing a heavy orthopedic surgical drill at the decontamination sink, the technician securely attaches a specialized dummy battery to the main handpiece before submerging it in the enzymatic solution. What is the absolute primary operational purpose of attaching this specific component during the manual washing phase? A. To completely seal the internal electrical motor and effectively keep all cleaning fluids from entering the unit. B. To continuously supply low-voltage power to test the mechanical triggers while scrubbing underneath the water. C. To physically prevent the heavy drill housing from rolling over and crushing delicate micro-instruments in the basin. D. To actively charge the internal capacitors, ensuring the device is ready for the immediate use steam cycle. Correct answer A. Knowledge point explanation. Core rationale. Powered surgical instruments contain highly complex and moisture-sensitive electrical motors and gears inside their main handpiece. If water or enzymatic detergent enters this housing, it will cause severe internal corrosion and catastrophic electrical failure. A decontamination battery or dedicated sealing hose is a solid physical block designed explicitly to seal the connection port, preventing any fluid ingress during washing. Trap analysis. Option B. Supplying active power while submerged in liquid creates an extreme electrocution and short-circuit hazard. This option would be correct if the technician were attaching a fully charged operational battery in the dry clean prep area to verify mechanical functionality before sterilization. Option C. Preventing instruments from rolling is achieved using proper sink loading techniques, not specialized sealing batteries. This option would be correct if the question asked what specific function a heavily textured silicone mat serves inside an orthopedic tray base. Option D. Charging batteries is never performed in the wet, highly contaminated decontamination area. This option would be correct if the question asked what specific task a technician performs utilizing a dedicated charging station located in the sterile storage or operating room core. Concept extension. Even with a decontamination battery securely attached, many powered handpieces are strictly prohibited from total fluid immersion by their manufacturer instructions, requiring meticulous manual wipe-downs instead. Question 84. A clean assembly technician physically inspects the environmental wall gauge in the preparation and packaging room and notes a temperature deviation. To ensure the facility engineer recalibrates the HVAC system to stay precisely within the 68 to 73 degree Fahrenheit range, which specific regulatory guidance document must the technician cite on the emergency maintenance ticket? A. The Occupational Safety and Health Administration Indoor Air Quality Worker Mandate. B. The Environmental Protection Agency External Chemical Emission Regulations. C. The local municipal building codes specific to the healthcare system geographic location. D. The ANSI OSHRI ASH 170 guidance specifically governing healthcare ventilation. Correct answer D. Knowledge point explanation. Core rationale. Environmental controls such as temperature, humidity, and air exchange rates in sterile processing are critical for maintaining packaging integrity and inhibiting microbial growth. AAMI standards explicitly defer to the ANSI OSHRI ASH 170 guidelines, which represent the definitive and legally recognized national standards specifically governing heating, ventilation, and air conditioning systems within healthcare facilities. Trap analysis. Option A. OSHA mandates protect workers from toxic chemical exposures like ethylene oxide gas but do not dictate the specific optimal temperature ranges for maintaining sterile medical packaging. This option would be correct if the technician were filling out a report regarding an 8-hour permissible exposure to a glutaraldehyde vapor. Option B. The EPA strictly governs outdoor environmental pollution and hazardous waste disposal, not the internal climate of a surgical prep room. This option would be correct if the technician were verifying how medical facility incinerator smoke is filtered before reaching the outside air. Option C. Local municipal codes dictate basic plumbing and structural requirements, but national healthcare-specific standards like ASHRAE 170 always override general local building guidelines for clinical spaces. This option would be correct if the technician were verifying the mandatory width of the public emergency exit doors in the hospital lobby. Concept extension. If the temperature in the prep and pack area exceeds 73 degrees, employees will begin to sweat, significantly increasing the risk of shedding skin cells and bacteria directly onto the clean instruments. Question 85. A technician is programming a multi-chamber automated washer disinfector for a heavy load of general surgical instruments. During the final phase of the mechanical cycle, what specific operational element acts as the primary absolute source to achieve high-level thermal disinfection? A. A concentrated automated injection of hydrogen peroxide liquid chemical. B. The highly elevated water temperature typically reaching 194 degrees Fahrenheit. C. A prolonged programmed exposure to a high pH alkaline cleaning detergent. D. The intense mechanical impingement force of the pressurized spray arms. Correct answer B. Knowledge point explanation. Core rationale. An automated washer disinfector relies on moist heat to kill microorganisms during its final phase. This process, known as thermal disinfection, utilizes highly elevated water temperatures, often sustained at 194 degrees Fahrenheit, for a specific contact time to successfully achieve high-level disinfection, rendering the instruments safe for human handling in the prep area. Trap analysis. Option A. Hydrogen peroxide is a chemical sterilant utilized strictly in low-temperature gas plasma systems, not inside liquid automated instrument washers. This option would be correct if the question asked what specific biocidal agent is completely ruined by cellulose-based wrappers. Option C. Alkaline detergents are utilized earlier in the cycle specifically to chemically dissolve tough fats and oils, not to achieve the final microbial disinfection. This option would be correct if the question asked what specific cleaning agent is automatically injected to combat heavy bioburden on orthopedic reamers. Option D. Impingement provides the physical mechanical scrubbing force necessary to blast away gross soil, but it does not thermally kill the remaining microbes. This option would be correct if the question asked what specific physical action requires instruments to be placed in open wire baskets rather than closed solid bins. Concept extension. To ensure the thermal disinfection phase is actually working correctly, facilities frequently place specialized thermal indicator strips inside the washer, which irreversibly change color when the required lethality temperature is reached. Question 86. A decontamination technician receives a newly purchased highly complex robotic surgical arm for the first time and must manually mix the appropriate sink detergent. To legally and physically verify whether to utilize a neutral or mildly alkaline chemical for this specific item, which exact entity must the technician consult? A. The company that manufactured the automated washer disinfector. B. The original corporation that manufactured the robotic medical device. C. The chemical company that formulated the enzymatic sink detergent. D. The Central Administration Board of the healthcare facility. Correct answer B. Knowledge point explanation. Core rationale. The original device manufacturer is the only entity that has scientifically validated a safe and effective cleaning and sterilization process for that specific surgical instrument. Their published instructions for use serve as the definitive legal document that sterile processing technicians must strictly follow without deviation. Trap analysis. Option A. The washer manufacturer provides the operational manual for the machine itself, not the surgical instruments placed inside it. This option would be correct if the technician needed to know how to perform a weekly descaling procedure on the mechanical chamber walls. Option C. The detergent manufacturer provides instructions on chemical dilution rates and water temperature activation, not the physical brushing requirements of a surgical tool. This option would be correct if the technician needed to know the exact ratio of chemical ounces to gallons of water for a soaking basin. Option D. The facility administration creates internal policies based on the manufacturer instructions but does not originate the primary validation data. This option would be correct if the technician were consulting the overarching employee dress code policy for the sterile processing department. Concept extension. If a manufacturer fails to provide comprehensive cleaning instructions, the facility must refuse to process or utilize the device until the proper validated documentation is legally supplied. Question 87. A sterile processing technician is physically loading a surgical case cart and finds a printed surgical schedule containing a patient name and exact medical diagnosis left inside the clean transport bin. The technician immediately shreds the paper to physically protect this sensitive data, acting in strict compliance with which federal legal responsibility? A. A voluntary personal ethical guideline. B. A general departmental employability skill. C. A strict federal legal responsibility. D. A resource management operational strategy. Correct answer C. Knowledge point explanation. Core rationale. Maintaining patient confidentiality is mandated by the Health Insurance Portability and Accountability Act. It is not merely a moral choice but a strict legal responsibility for every healthcare worker, including sterile processing technicians. Breaching this confidentiality can result in termination, severe financial penalties, and federal prosecution. Trap analysis. Option A. Ethics govern moral choices like doing the right thing when nobody is watching, while HIPAA is an enforceable law. This option would be correct if the technician were deciding whether to voluntarily report their own accidental contamination of a sterile tray. Option B. Employability encompasses general workplace habits like punctuality and teamwork. This option would be correct if the technician were being evaluated on arriving exactly on time for a scheduled shift. Option D. Resource management involves tracking physical inventory and utilizing supplies efficiently. This option would be correct if the technician were tracking the daily usage of disposable biological indicators. Concept extension. Technicians must never discuss patient details, surgical cases, or surgeon preferences in public areas such as elevators or cafeterias where unauthorized individuals might overhear the conversation. Question 88. During the manual decontamination of a heavily soiled cardiovascular tray, a technician notices a pale yellowish fluid mixed with the clotted red cells. The technician recalls from basic anatomy training that this specific yellowish liquid comprises over 55% of total human blood volume. What is the precise name of this fluid component? A. Clotting platelets. B. Oxygen-carrying red blood cells. C. Infection-fighting white blood cells. D. Fluid blood plasma. Correct answer D. Knowledge point explanation. Core rationale. Human blood is composed of solid cellular elements suspended in liquid matrix. Plasma is that pale yellowish liquid constituting more than 55% of the blood. It carries vital nutrients, hormones, and the solid blood cells throughout the circulatory system and leaves a sticky protein residue on surgical instruments. Trap analysis. Option A. Platelets are solid cellular fragments responsible for blood clotting, not the liquid volume. This option would be correct if the question asked what specific solid component instantly aggregates to stop a bleeding vessel during surgery. Option B. Red blood cells are the solid elements that transport oxygen and give blood its crimson color. This option would be correct if the question asked what specific element makes heavy gross soil appear bright red on a surgical retractor. Option C. White blood cells are the solid immune cells that combat foreign pathogens. This option would be correct if the question asked what specific blood component actively attacks invading microbial organisms at an infection site. Concept extension. The heavy protein content within blood plasma requires cold or lukewarm water during the initial rinsing phase because utilizing hot water will instantly coagulate and bake these proteins directly onto the stainless steel. Question 89. A clean assembly technician utilizes a pressurized medical air hose to thoroughly blow dry the internal lumens of a complex flexible endoscope. The technician performs this aggressive physical drying step to specifically eliminate ambient moisture and prevent the rapid multiplication of which oxygen-dependent microorganisms? A. General pathogenic microbes. B. Oxygen-starved anaerobic bacteria. C. Oxygen-requiring aerobic bacteria. D. Comma-shaped Vibrio cells. Correct answer C. Knowledge point explanation. Core rationale. In microbiology, bacteria are classified by their environmental requirements for survival. Aerobic bacteria specifically require the presence of free oxygen to live, grow, and multiply. Ensuring instruments are completely dry eliminates the moisture these aerobic microbes need to thrive in the oxygen-rich ambient air of the prep room. Trap analysis. Option A. Pathogenic is a broad term indicating any microorganism capable of causing disease regardless of its oxygen requirements. This option would be correct if the technician were utilizing a general umbrella term to describe any microbe that actively makes a patient sick. Option B. Anaerobic bacteria strictly survive in environments devoid of oxygen and will die if exposed to ambient air. This option would be correct if the technician were inspecting a deep puncture wound instrument for microbes that strictly survive in environments devoid of oxygen. Option D. Vibrio describes the physical comma shape of a bacterium, not its respiratory oxygen requirements. This option would be correct if the technician were identifying the physical comma shape of a bacterial cell under a microscope. Concept extension. Leaving moisture inside an endoscope channel allows aerobic bacteria like Pseudomonas to rapidly form an impenetrable biofilm, making thorough air drying a critical final step. Question 90. A technician is reviewing the daily operating room schedule to accurately build case carts. They encounter a procedure listed as a total thyroidectomy. By analyzing the structural suffix located at the very end of this medical term, the technician determines the surgeon will execute which exact physical action on the thyroid gland. A. The complete physical surgical removal of the organ. B. The medical treatment of an active tissue inflammation. C. The physical surgical revision and reconstruction of the gland. D. The internal visual examination utilizing a lighted optical scope. Correct answer A. Knowledge point explanation. Core rationale. In medical terminology, suffixes provide the procedural definition. The suffix ectomy translates directly to surgical excision or complete physical removal of an anatomical structure. Therefore, a thyroidectomy dictates that the surgeon will physically cut out and remove the thyroid gland. Trap analysis. Option B. Inflammation utilizes the suffix itis, indicating a condition rather than a surgical removal process. This option would be correct if the medical term on the patient chart was listed as thyroiditis. Option C. surgical revision or reconstruction utilizes the suffix plasty. This option would be correct if the technician were gathering specialized instruments for a cosmetic rhinoplasty procedure. Option D, visual examination utilizes the suffix scopy. This option would be correct if the technician were preparing a flexible optical instrument intended for a routine colonoscopy. Concept extension. Identifying the ectomy suffix alerts the sterile processing technician that the surgeon will need heavy dissecting scissors, tissue clamps, and ligation devices to physically cut and remove the targeted organ safely. Question 91. A technician at the manual decontamination sink is preparing to perform the initial flushing and washing of a bloody orthopedic drill. According to AAMI water quality guidelines, which specific type of water must the technician dispense from the faucet for these preliminary cleaning steps? A. Highly purified critical water. B. Standard municipal utility water. C. Specialized carbon filtered water. D. Chemically treated boiler water. Correct answer B. Knowledge point explanation. Core rationale. According to AAMI guidelines, utility water is the official term for standard tap water that flows directly into the facility. Because it contains minerals, it is only utilized for the initial flushing, washing, and preliminary rinsing phases of decontamination before the final pure rinse is applied. Trap analysis. Option A. Critical water is heavily treated to remove minerals and is strictly reserved for the final rinse phase. This option would be correct if the question asked what specific fluid prevents hard mineral staining prior to sterilization. Option C. Filtered water is a generic descriptive term rather than the specific AAMI classification for sink tap water. This option would be correct if the question asked what general mechanism a refrigerator drinking fountain utilizes to improve water taste. Option D. Boiler water is heavily treated with specific chemicals to generate steam and is never dispensed into a washing sink. This option would be correct if the question asked what fluid supply must be meticulously tested to prevent chemical carryover into the autoclave chamber. Concept extension. If utility water is exceptionally hard, heavily laden with calcium and magnesium, the facility may need to install special water softeners to ensure the enzymatic sink detergents can activate properly. Question 92. A clean assembly technician physically measures the prep room temperature and compares the reading against the facility policy manual based on AAMI guidelines and OSHA regulations. What foundational operational threshold do these compiled regulatory documents legally and professionally establish for the technician daily physical tasks? A. The minimum acceptable baseline levels of quality and safety. B. The recommended guidelines for facility legal protection. C. The required goals for individual employee advancement. D. The standardized equal pay practices across the facility. Correct answer A. Knowledge point explanation. Core rationale. Regulations from governmental bodies and consensus standards from professional organizations define the absolute floor of clinical practice. They legally and professionally establish the minimum acceptable baseline levels of quality and safety that every healthcare facility must maintain to protect patients and workers from harm. Trap analysis. Option B. Guidelines for legal protection are generated by hospital risk management lawyers, not clinical standard organizations. This option would be correct if the question asked what purpose a facility malpractice insurance audit serves. Option C. Employee advancement goals are internal human resources metrics outlined during annual performance reviews. This option would be correct if the question asked what specific topic a supervisor discusses with a technician looking to become a shift lead. Option D. Equal pay practices are dictated by federal labor laws entirely separate from sterile processing clinical standards. This option would be correct if the question asked what specific standard the Federal Equal Employment Opportunity Commission heavily enforces. Concept extension. Sterile processing managers are heavily encouraged to develop internal departmental policies that far exceed these minimum regulatory baselines to provide an exceptionally high standard of patient care. Question 93. A technician is carefully organizing a massive cardiovascular surgical set inside a rigid sterilization container. To physically protect the delicate micro-scissors and prevent structural damage during transport, how must the technician arrange the heavy metal retractors? A. Placed securely on the absolute bottom of the tray basket. B. Suspended inside paper plastic peel pouches on the side. C. Positioned directly on top of the delicate items to prevent shifting. D. Wrapped tightly in absorbent wicking material on the top tier. Correct answer A. Knowledge point explanation. Core rationale. When assembling any surgical tray, the technician must follow strict weight distribution rules. Heavy bulky instruments like mallets and retractors must always be placed on the absolute bottom of the tray basket. This physically prevents them from crushing, bending, or breaking the fragile delicate instruments positioned safely above them during routine transport and handling. Trap analysis. Option B. Placing paper plastic peel pouches inside an instrument tray is a severe safety violation that prevents proper steam penetration. This option would be correct if the question asked what illegal internal packaging practice guarantees a sterilization failure inside a rigid container. Option C. Placing heavy items on top of delicate items is the exact negligent action that causes devastating physical damage to surgical tools. This option would be correct if the question asked what specific poor assembly practice guarantees a pair of expensive micro-forceps will be permanently bent out of alignment. Option D. Wicking material is used to absorb moisture, not to tightly wrap individual heavy items on the top tier. This option would be correct if the question asked how a technician should arrange surgical towels between heavy nesting basins to absorb massive condensation. Concept extension. Beyond weight distribution, the technician must also ensure that all heavy retractors are fully opened or unlocked to allow the steam sterilant to easily reach every hidden crevice and box lock. Question 94. A decontamination technician physically uncoils a heavily soiled flexible laryngoscope that a surgeon just utilized to examine a patient intact vocal cords and mucous membranes. According to the Spaulding classification system, what is the absolute minimum reprocessing standard the technician must achieve for this specific device? A. High-level disinfection. B. Intermediate-level disinfection. C. Low-level disinfection. D. Terminal sterilization. Correct answer A. Knowledge point explanation. Core rationale. The Spaulding classification system dictates that any medical device contacting intact mucous membranes without penetrating sterile tissue is classified as a semi-critical item. The absolute minimum mandated processing standard for a semi-critical item like a laryngoscope or gastroscope is high-level disinfection, which eradicates all microorganisms except a small number of bacterial spores. Trap analysis. Option B. Intermediate-level disinfection kills mycobacteria but is only acceptable for non-critical items touching intact skin. This option would be correct if the question asked what specific wiping protocol is required for a reusable blood pressure cuff exposed to a patient with tuberculosis. Option C. Low-level disinfection kills basic vegetative bacteria and is reserved for environmental surfaces or non-critical items. This option would be correct if the question asked what processing level is required for a patient transport wheelchair or an intravenous fluid pole. Option D. Terminal sterilization is the highest level of lethality and is strictly mandated for critical items that enter the bloodstream. This option would be correct if the question asked what absolute minimum processing standard is required for a rigid arthroscope penetrating a sterile knee joint. Concept extension. While high-level disinfection is the minimum legal requirement if a semi-critical item is completely heat-tolerant and can withstand the autoclave, terminal sterilization is always the strongly preferred best practice. Question 95. A newly hired decontamination technician physically signs a formal human resources document before donning their heavy personal protective equipment for the first time. The document specifically outlines their exact physical daily duties, such as operating steam sterilizers and manually brushing instrument trays. What is the precise administrative term for this specific document? A. A job duty list. B. A job specification. C. A task summary review. D. A job description. Correct answer D. Knowledge point explanation. Core rationale. In human resources management, a job description is the official legally binding document that identifies and details the major tasks, responsibilities, and specific physical duties performed by a person holding a specific position within the facility. It tells the employee exactly what daily clinical actions they are expected to execute. Trap analysis. Option A. A job duty list is an informal descriptive phrase, not the official administrative human resources term. This option would be correct if the question asked for a casual slang term a floor supervisor might use to assign daily sink rotations. Option B. A job specification details the mandatory personal qualifications required to get the job rather than the actual duties performed. This option would be correct if the question asked what document explicitly states that an applicant must possess a CRCST certification and the ability to lift 50 pounds. Option C. A task summary review is a fabricated administrative term. This option would be correct if a facility invented a unique localized name for their annual employee performance evaluations. Concept extension. Technicians should review their job description annually with their supervisor to ensure they are meeting all expectations and to discuss any new technological responsibilities added to the department. Question 96. A technician is assembling an instrument tray for an endoscopic transsphenoidal surgery. The preference card notes the surgeon is removing a tumor from the master gland that sits at the base of the brain and secretes hormones to actively stimulate physical body development. Which specific anatomical target is this specialized tray designed for? A. The adrenal gland located above the kidneys. B. The thyroid gland located in the anterior neck. C. The pancreas located behind the stomach. D. The pituitary gland located at the brain base. Correct answer D. Knowledge point explanation. Core rationale. Understanding basic anatomy helps technicians prepare the correct surgical instruments. The pituitary gland is a pea-sized structure at the base of the brain widely known as the master gland. It secretes growth hormone which directly stimulates the physical growth and development of the human body. Trap analysis. Option A. The adrenal glands secrete adrenaline to manage physical stress and fight or flight responses. This option would be correct if the technician were pulling long laparoscopic instruments for an adrenalectomy procedure. Option B. The thyroid gland regulates the overall metabolic rate of the human body. This option would be correct if the technician were gathering self-retaining retractors for a neck incision. Option C. The pancreas secretes insulin to strictly regulate blood sugar levels. This option would be correct if the technician were preparing a major abdominal set for a Whipple procedure. Concept extension. Instruments utilized for transsphenoidal pituitary surgery are exceptionally long and delicate bayonet-style forceps that require extremely careful manual brushing during decontamination to prevent tip misalignment. Question 97. While loading a multi-level cart for a heavy steam cycle, a technician needs to place a liner on the bottom rack to prevent water droplets from the top shelf from splashing onto the packages below. To comply with AAMI loading protocols, which specific type of material must the technician utilize for this shelf liner? A. A disposable spunbond polypropylene blue wrapper. B. A reusable waterproof silicone transport pad. C. A sterile disposable absorbent medical towel. D. A thick impermeable plastic containment sheet. Correct answer C. Knowledge point explanation. Core rationale. AAMI guidelines dictate that when utilizing a shelf liner to catch dripping condensate inside a steam sterilizer, the material must be highly absorbent and validated for sterilization. An absorbent medical towel effectively catches and holds the moisture, allowing it to evaporate during the dry time rather than pooling and splashing onto other packages. Trap analysis. Option A. Polypropylene wraps are designed to repel water, not absorb it, causing the condensate to instantly puddle and run off the edges. This option would be correct if the question asked what synthetic material is utilized to formally wrap a heavy instrument tray. Option B. Silicone pads are non-absorbent and will create large pools of boiling water inside the chamber, guaranteeing wet packs. This option would be correct if the question asked what specific internal material prevents sharp retractors from shifting inside a rigid aluminum container. Option D. Plastic sheets completely block steam circulation and instantly trap massive amounts of water. This option would be correct if the question asked what material is utilized as a protective dust cover after the sterile tray has entirely cooled. Concept extension. Placing an absorbent liner under heavy basin sets provides an additional layer of protection against wet packs by immediately wicking away any excess moisture that drains from the tilted metal bowls. Question 98. A sterilization technician physically inspects the external digital ventilation gauge outside a newly built room housing an ethylene oxide sterilizer before pushing a loaded cart inside. To ensure any toxic fugitive gas emissions are rapidly vented to the outside and to strictly comply with OSHA worker safety mandates, the technician must visually verify the room ventilation achieves what absolute minimum airflow rate? A. Exactly 10 total air exchanges per hour. B. Exactly 20 total air exchanges per hour. C. A minimum of 15 total air exchanges per hour. D. A maximum of 4 total air exchanges per hour. Correct answer A. Knowledge point explanation. Core rationale: ethylene oxide is a highly hazardous carcinogenic gas. To protect employees from dangerous occupational exposure, standard industry regulations explicitly require that the dedicated room housing the ethylene oxide sterilizer maintains a strict minimum of 10 air exchanges per hour combined with a continuous negative air pressure flow. Trap analysis. Option B. 20 air exchanges is significantly higher than the mandated baseline standard for sterile processing areas. This option would be correct if the question asked what the required air exchange rate is for a highly sterile operating room theater during an active surgical procedure. Option C. 15 air exchanges is an incorrect standard for the ethylene oxide room. This option would be correct if the question asked what specific intermediate standard applies to certain isolated hazardous medication compounding rooms. Option D. 4 air exchanges per hour is dangerously low for a room containing toxic gas. This option would be correct if the question asked what specific minimum ventilation rate is required for the dedicated climate-controlled sterile storage inventory room. Concept extension. The exhaust ventilation for the ethylene oxide room must be entirely dedicated and directly vented to the outside atmosphere, never recirculated back into the general hospital ventilation grid. Question 99. A technician in the clean assembly area is inspecting a heavy pistol grip laminectomy rongeur intended for a spinal fusion procedure. To accurately verify that the sharp jaws will perform a clean punching action without tearing the patient bone, which specific testing medium must the technician physically utilize? A. A single sheet of single-ply tissue paper. B. A standard cylindrical plastic dowel rod. C. A thin strip of yellow rubber testing latex. D. A standard stiff paper cardboard index card. Correct answer D. Knowledge point explanation. Core rationale. Rongeurs such as the Kerrison or laminectomy styles are heavy-duty bone-biting instruments utilized in spine surgery. Industry testing protocols dictate that the technician must actuate the jaws to punch a hole through a standard index card. The instrument passes the test if it bites a perfectly clean geometric hole without snagging or tearing the stiff paper. Trap analysis. Option A. Tissue paper is extremely flimsy and does not provide enough resistance to properly test a heavy bone-cutting jaw. This option would be correct if the technician were improperly attempting to test the sharpness of a generic utility shear. Option B. A plastic dowel rod is utilized for scraping instruments, not punching instruments. This option would be correct if the technician were verifying the functional sharpness of an orthopedic bone curette. Option C. Yellow rubber latex is strictly utilized to test the slicing action of delicate microsurgical blades. This option would be correct if the technician were inspecting a lightweight 4-inch tenotomy scissor for an eye procedure. Concept extension. If a kerosene rongeur tears the index card rather than punching a clean hole, the technician must immediately pull it from service and send it to a specialized repair facility for professional sharpening. Question 100. A technician at the decontamination sink is inspecting a newly utilized wrist robotic surgical instrument before applying the enzymatic detergent. To ensure the complex articulation mechanism is thoroughly cleaned and free of hidden bioburden, which specific structural feature located near the proximal connection housing must the technician meticulously examine? A. The exposed internal pull wires and articulation cables. B. The integrated flush ports equipped with silicone valves. C. The delicate fiber optic glass rod lenses. D. The external corrugated plastic insulation sheathing. Correct answer A. Knowledge point explanation. Core rationale. Robotic instruments possess a highly unique mechanical design featuring internal wire cables that allow the distal tip to pivot and articulate with extreme precision. These cables are often visibly exposed at the proximal end where they connect to the robotic drive motors. Technicians must aggressively inspect these exposed cables as they easily fray, break, and trap massive amounts of microscopic tissue. Trap analysis. Option B. While flush ports exist on robotic tools, the primary unique structural vulnerability identifying these specific instruments are the drive cables. This option would be correct if the question asked what specific cleaning mechanism must be directly connected to a pressurized water pistol during the sink phase. Option C. Robotic grasping instruments do not contain internal lenses, they rely on a separate external camera arm for visualization. This option would be correct if the technician were inspecting a rigid 30-degree laparoscope dropped by a surgeon. Option D. Robotic instruments utilize smooth flush insulation along the shaft, not corrugated sheathing, to permit easy passage through surgical trocars. This option would be correct if the question asked what type of disposable tubing connects an anesthesia machine to a patient airway. Concept extension. Due to their extreme mechanical complexity, robotic instruments frequently require a completely separate specialized automated washing cycle distinct from standard stainless steel surgical sets.